Good afternoon and welcome everybody to our first campus weekly COVID-19 briefing. Thank you all for joining us today. I'd like to note that the live captioning is available and that a recording of this session will be posted for those unable to see it in real time. It'll be posted later today. This will become a weekly event every Friday at 1 o'clock. And today we need to finish a bit early at 1:45, but typically we'll continue on to 2. It's modeled after a very successful series run at Michigan Medicine of similar Friday afternoon briefings. I'd like to introduce this week's participants and discuss the agenda a bit. We're joined today by Provost Susan Collins, Vice President for Student Life, Martino Harmon, our Chief Campus Health Officer, Dr. Preeti Malani, and each of them will give brief updates in a moment. Our special guest this afternoon is Professor Emily Martin from our School of Public Health, and she'll present information on our campus response metrics, which were just posted recently, followed by a brief discussion with Dr. Malani. We've been gathering questions that have come in through the invitation that we sent out recently, and we'll answer some of those, as well as those that come in through the chat function live during today's discussion. So first, let me turn it over to Dr. Malani, who'll talk about and update us on conditions on the campus right now. Dr. Malani?
Thank you, Mark. So as illustrated on the campus dashboard, there have been more cases this past week, and there are about 280 cases actually since September 20th, including new clusters at Mosher Jordan and Alice Lloyd, along with several off-campus settings. And the case investigation of these COVID cases continues to highlight social gatherings as risk factors, along with close contact with someone who has had COVID. Fortunately, we are not seeing spread in casual settings, in dining halls, in classrooms, other shared places, but rather it's that close physical contact. There have been some successes too, including South Quad, which you might remember a couple weeks ago, there was an outbreak there. There was a cluster, and there was an effort to enhance mitigation along with broad testing, and the additional cases that did emerge were thankfully just a handful. And we continue to also see cases diagnosed off-site at local urgent cares. I want to remind everyone that COVID is a reportable illness, and those results eventually do come back to our campus health officials, but there can be a lag of 1 or 2 days. Students are reminded that getting tested at UHS is convenient, and it also offers a connection to all the other support mechanisms that are needed for the Dean of Students. Also important is the emotional support. I mean, this is a stressful diagnosis for people to receive, including our students. Speaking of students, cooperation with case investigation and contact tracing is not optional. It's been made very clear that the health of our community depends on everyone being honest. If you haven't done so, I'd encourage you to sign up for the Community Sampling and Tracking Program, which Dr. Martin oversees. This is a way to really understand what's happening on campus by testing a portion of the community each week who are asymptomatic. I want to give a shout out to the team at UHS. They're there 7 days a week. Last week, they saw more than 400 students with symptoms. Fortunately, only a handful, small portion, I will say, had actual infection. They continue to have lots of capacity. And really more than anything, and I say this as a U of M parent, the team has a lot of experience taking care of students with COVID. It's very different than what we do at Michigan Medicine. And I think it's important to really address all aspects of well-being. Earlier this week, the university shared some additional details around the campus response metrics and mitigation strategies related to COVID-19, and Dr. Martin's going to talk about that a bit. You know, I just want to reflect for a moment that the whole response to COVID is a little bit like making a boat out of a car. It's imperfect, it's messy, but here we are 5 weeks into the semester, we're floating, we're still in the water. It's complex, it's uncertain, and things keep changing, and we're also adapting and changing. And although it might have felt easier, frankly, to be fully remote, that also hasn't worked out well for some of our peer institutions. And you know, I say this each time that there's not an easy end in sight, but as we learn more, we're getting comfortable to sort of life with COVID, you know, sort of getting back to some of the important activities that we need to do. And the Campus Health Response Committee has been working like day and night. And when things aren't matched up perfectly, it's not nefarious intent. It's just that things are moving and they're trying to keep up. I do get a lot of emails, especially from faculty and parents. Some of the emails are not that nice. And I remind myself that on the other side is someone who is feeling distressed. And this is a really difficult time for our students, for the community. I want to remind everyone about the importance of kindness and patience. We have 7 weeks to go, and the way we're going to get through those 7 weeks is by wearing our masks, which our students have been doing and we've been doing, keeping our distance and avoiding large gathering. And I'm just leaving you with a question to reflect on, is what does success look like for you personally, for the campus, and if you're a parent, for your student this semester?
Thanks very much, Preeti. Those were great words. I turn things over to Provost Collins to give us an academic update.
Great, thank you very much, and delighted to be here. As you know, the fall semester is well underway. We're 5 weeks in, and as most of you probably know, most of our courses, 78% of undergraduate credits, are being offered remotely, with the rest a kind of mix of hybrid and in-person formats. The density in our schools and colleges remains quite low, and compared to past years, an average of about 40% in our non-residential buildings on campus. Teaching and learning in this really stressful and complex context is difficult, and I want to thank all of our instructors for the hard work and the creativity that they continue to display, and also our students for their dedication. The many ways that people are finding to connect with each other and engage and continue the kind of academic excellence in a difficult context. We're working now to plan for our winter semester, and just as a reminder, we altered the academic calendar for health and safety reasons, and classes for winter 2021 will begin on January 19th following the annual Martin Luther King Jr. Symposium. We've canceled the spring break to allow the term to end on schedule despite the later start. We've learned a lot from experiences with fall teaching, and this has been essential for incorporating into our planning, and we'll continue to focus on health and safety for all members of our community as well as on academic excellence. We'll be reaching out to gather information from our instructors, our students, our staff across the schools and colleges, and your experiences will really help us assess what's working well and what some of the things are that we need to continue to improve. So we'll have more details about winter planning shortly. I'd like to turn briefly to our budget. The fiscal year 21 budget that was approved in June contained reductions to all of our general fund revenue sources, shared sacrifice among all members of our faculty and staff to contain costs, and a huge amount of uncertainty. And my update today is able to resolve some of that uncertainty. Our budget that was planned actually for a 0% increase in state support. State budget has just been approved and signed by the governor, and we're actually quite relieved that appropriations for the university will remain the same as last year and at the level that we used for our budget. The news about our state appropriations provides an important dimension of stability for our budget estimates for this year. The budget that we passed in June included modest drops to enrollment, and in fact, the fall 2020 enrollment data does show a modest drop from last year. So here too, we are on track with projections and on target with the budget. We'll be providing more details about enrollment, including information about the entering class in the coming weeks. Lastly, the budget that was passed in June reflected a series of new efforts to constrain costs that really go well beyond the ongoing cost containment measures that the university adopts annually. And I'd like to take a moment just to thank all of you for the efforts along these lines, which often involve personal sacrifices. It's through those efforts that we have a balanced budget. But we're not out of the woods. The pandemic continues to involve significant uncertainty, such as about our winter 2021 enrollments and the costs of delivering our academic mission and the future context for the state, including for the coming fiscal year. The additional costs for a safe, public health informed semester continue to rise, and they include the COVID testing, instructional technology and redesign, PPE, safety equipment, isolation quarantine spaces, enhancing cleaning products and custodial services. There, I just want to pause. Today, as you may know, is World Custodian Day, and just want to take the time on behalf of the entire university to give my sincere appreciation on all of the essential work that these frontline workers and members of our community do every day. Thank you very much. So while concerns do remain for the longer term, the actions we've taken are working, and our budget has stabilized in the near term. So from a budgetary perspective, we'll stay the course with the expenditure restrictions. We need to continue managing through the constraints on our revenue, the additional cost pressures, and the uncertainty. And so with that, I'll stop. Thank you very much.
Thanks, Susan. I next turn to really the newest member of our leadership team, Vice President of Student Life, Martino Harmon. Martino.
Thank you, President Chaliso, and good afternoon. I'm going to provide an update on 5 important topics, and I want to start with our student employees. We care deeply about the safety and the well-being of all of our student employees, and particularly I want to focus on our student employees in housing, our res staff, as we call them, as well as the dining student employees. Even after resolving the work stoppage amongst the RA, the res staff group, we've been in constant communication with them, and we'll continue to listen and respond to their needs. As a matter of fact, I'm personally listening and visiting and talking with our student employees in housing and dining so that I can tell them that I care, but also understand their needs. They're on the front line, and we need to really continue to work to help to keep them safe. I'm really excited that our rec sports facilities are now open. They opened this past Monday, and that opening has gone very well. After implementing a number of new regulations and procedures, we really managed a smooth opening, and we received a lot of positive feedback. We're extremely happy with the compliance and our safety measures, and everyone is wearing a mask, which is critically important, and students seem to be adjusting well to working out with masks on. We're spacing things out, we're covering things up, and we're keeping surfaces clean. Our exercise and stretching and functional fitness areas are spaced out to ensure physical distancing. Students are downloading the Rec Sports app, so that allows them to have contactless entry. Masks are required at all times, except while swimming. That would be a little difficult, showering or drinking. And we're stocked with plenty of wipes and sanitizer stations throughout the facilities. Next, we're focused on student engagement in campus climate activities around the election, and that's pre and post. We've always been engaged in civic engagement, but during an election year, we've naturally amped up our activities around this particular element of our core work. Particularly, the Ginsburg Center is leading many of our pre and post-election activities, such as the Debate Watch Toolkit to help make sense of the debate, including background information and prompts for discussion. Next, I want to talk about football. As you can see from my background, I'm excited about football, my first Michigan football season, as well as fall sports. But it also creates a need for planning around safety. So in addition to the establishment of a campus-wide committee that centers around safety during the football season, and that's led by VP Cynthia Wilbanks, Student Life is involved with the Ann Arbor Campus Committee Coalition, and that group met this past week to really talk about sharing communication and messaging around the football season to make sure key stakeholders in the community and the campus are aware. There's a high-risk planning group that is actually convened by Dean Laura Blake Jones, and they will meet on October 8th to execute a multi-pronged approach to address the potential points of harm that can occur during this time period. The group will discuss how we keep all the complex issues in mind, particularly around the University of Michigan and Michigan State game on Halloween Day. We'll use an evidence-based approach that includes offering alcohol-free and COVID-informed social options. Students want to know what can we do, not just what we can't do. We want to create messaging that focuses on positive social norming, and then we'll coordinate communications about policy enforcement and accountability. The University of Michigan and Michigan State staffs are actually meeting to create shared messaging for students and recommendations on strategies to reduce harm and to protect our campus communities. And we're not just focused on the home games, but it's safety around all the games, because even the away games, there are opportunities for people to gather. My last item touches on our work with public affairs and University of Michigan students around the refocus of the Wolverine culture of care. I'm sure you've heard a little bit about the culture of care. but we've taken into account feedback from a number of groups, as well as the need to continually evolve in response to changing circumstances like colder weather, indoor gatherings, and football, of course. The COVID reporting line and voluntary address and phone registry for students living off campus has been very successful in reducing large gatherings. This effort will continue. It has continued. Our refocused efforts include a revised campaign designed to promote safety measures given the different conditions. And specifically, we're focused on giving more students an opportunity to opt in to the registry so we can get their contact information. And we're also going to promote the regular use of Responsive Blue, the symptoms tracking tool, because that's critically important. And we're reminding students how important it is for them to report a positive diagnosis, respond promptly to case investigators, and provide complete information about close contacts. As planned, we're using the Statement of Student Rights and Responsibilities addendum as needed when we have to address issues of accountability, particularly individual accountability, but we also address group accountability situations as well. And a few situations as merited are referred to Oscar for further disciplinary action. And finally, while the university has continued the use of students, faculty, and staff to canvass surrounding campus neighborhoods through the Michigan Ambassadors Program. But however, I wanted to point out that DPSS will continue to work with Ann Arbor Police to address safety issues in an educational and enforcement manner. Thank you.
Thanks, Martino. Just very briefly, I want to highlight the fact that we've changed recently the way we present case data on our Maize and Blueprint website, where we track, update dashboard-like data on cases on campus. We used to only report cases that were tested on campus through University Health. We realized that many students have gone off campus for their testing, and we have now captured those results and they get added onto the dashboard as well. So it provides a clearer total representation of the number of cases each week that are occurring amongst our students, faculty, and staff. I must urge everyone, though, as Dr. Milani did, to have their testing done on campus if at all possible. We get the results faster and we can help do case tracking and help keep everyone safe faster. Since COVID-19 is a reportable disease, no matter where you take the test, the county health department finds out about positive results, and we work very closely with them. So we learn about those results as well. We put them up on the dashboard, and then we collaborate with the county health department on investigating cases. So that's all the data. And finally, I'll also note that the data gets corrected every day. It gets corrected through collaboration with the health department, where they may change the number of cases discovered on a particular day or change the day that a case was said to have begun. And that's a normal process of correcting public health data. So if you see the data changing day by day, those are official corrections done in collaboration with the health department. We've got saliva testing coming on board starting next week. It'll be easier and faster, and we're expanding our surveillance and other testing modalities. So things are changing, and we'll talk more about that in the days ahead. But I'd like to turn things over to our special guest today, Professor Emily Martin from the School of Public Health, who's been involved in helping us design the best ways to keep the campus safe, and also is one of the principal advisors of the governor and her administration and the outstanding job they're doing with the state as a whole. So thanks for joining us, Emily. It's all yours.
Great, thank you very much. And thanks for having me on today. I'm going to spend a couple of minutes talking about some of the thinking around the campus response metrics and mitigation strategies and where some of that has come out of. So, you know, this document came out of the work of the Campus Health Response Committee, which has been mentioned a few times already as the committee that is actively both planning and implementing aspects of the response, but then also really heavily monitoring data, both data on campus, data that we're gathering off campus, data from the region, from the state, from all different, all sorts of data that we can get our hands on to be able to look at things. And the thinking around this document has heavily relied on work that was done by the School of Public Health team early in the spring and in the summer to develop what we called a framework for monitoring COVID-19. It's it's kind of formed around 3 different key streams of data that we tend to advise around collating and looking at to inform policymakers. And these are the 3 streams of data. One is increases in disease spread. So how is the disease moving? How fast is it moving around the community? How fast is it increasing? And what are the trends, both what is the level of disease in the community, but what are the trends that we are seeing in our campus and in the community around us? Because we do recognize that we are a very connected campus with our surrounding communities. So we look at both. We look at what's happening in the county, we look at what's happening here on campus. We're also looking at other factors that are really important. So what is the impact of virus spread on our ability to respond as a public health system? Do we have the capacity for case investigation, for contact tracing? Do we have the ability to place people in quarantine and isolation housing quickly? And is there enough housing to accommodate those needs? And so we could envision situations where the disease the disease spread is level or not changing at a very rapid pace, but because people are in quarantine housing for the 2-week time they need to be there, maybe we would have a resource constraint there that we would need to monitor. So that has to be monitored as a separate stream. The third thing that we look at are our community and health system capacity as well. So you may remember in March and in April, a lot of the conversation was around whether we simply had enough healthcare capacity in our region to take care of people that needed to be taken care of. So to take care of symptomatic cases and people in need of medical care and hospitalization if they needed it. And so we look at those things as well. We both look at it from a campus perspective. Does UHS have the bandwidth to take care of everyone they need to? But then what do our local health system partners look like in terms of their bandwidth as well? And so we look at all of those factors also. So one of the things that I've found really interesting about this process as I've been participating in it, both in partnership with the state health department and with local health departments, and then now with the campus, is that there's a really huge importance of understanding the on-the-ground context to numbers as well. Numbers can only tell you so much. You have to also understand, are these numbers representing clusters, or are they representing sporadic, unconnected cases? If they're representing clusters, are we seeing clusters where we've got kind of our arms around the situation and we know the contacts that are impacted by this cluster? Or are they coming out of maybe a big event with a lot of different contacts, maybe not even the ability to identify all the contacts? And that's a situation where the health department may ask for a larger level of mitigation or larger notifications that would happen if we had something that's that spread. And so there's, there's the numbers themselves, but there's also a lot of just continually talking to our local health officials and people on campus, try to see where things are going. And the reason understanding that context is important is because it helps us pick the right mitigation tool from our toolbox. Not every tool is the right tool to stop an increase in numbers, right? We want to be connected to the root of the problem as much as possible. So we're picking the right thing to respond to. And so it could be things like, you may have seen reports about a lot of targeted testing that's happened lately, where we'll see some signals in the data and say, okay, we're going to test these 2 floors of this residence hall. That's an example of using a targeted tool based on a data feed that we're seeing. And so it's kind of this feedback loop of the data to implement a tool and then see how the tool is working, look at the data, modify the tool, improve the tool. And the selection of tools can be wide from small changes to big changes. The more we do this as a university, the more we can build our infrastructure, both for that data, but then the infrastructure for tools. So build testing, build other mitigation strategy tools that we can continue to deploy. So that's sort of the thinking is this connection between having that good data and then having that responsiveness that can adapt to the situation on the ground in the best way possible.
Thanks, Emily. Preeti, you were going to discuss this program with Emily, if you would.
Yeah, absolutely. Thank you. And yeah, I could listen to Emily talk about this all day. I really love one of the silver linings of the pandemic has been getting to work with her. Now, Emily, can you just talk a little bit about the process of like what was involved in getting this list of response metrics?
Absolutely. So, you know, it was a great, I'm going to start back with the SBH, the process at School of Public Health in the beginning and starting to develop the framework. I mean, we worked with partners at the state. We worked internally broadly across different groups in the school. We worked with a lot of national groups that are providing a lot of advice on how to calibrate these metrics. There are numbers right now that people are really used to hearing. Like percent positivity used to be a very wonky infectious disease epidemiologist number, and now everybody knows what it is and has an opinion on it. And so we had to filter through how do we build this as we are starting to need it. Not only that, but also think about how do you level and how do you advise both individuals but then policymakers on the risk calibration at these different levels. And we've talked to business leaders, we've talked to all sorts of people as we've kind of built our way of thinking about this. And so then when it came time to do this in campus, not only had we had these conversations already, but I've read every response metrics plan of every state at least twice. You know, so we've had this huge capture of what everybody else is doing too to kind of inform our way forward on this. And so it's been quite a process going on over the last couple of months.
I'm gonna make sure I send you a gift card for like some better reading. But anyway, that's separate. You know, one of the things that it's come up a little bit in the chat too is, you know, back in March we made this like rapid, unplanned pivot from like being here and doing everything normally to like closing the door, turning off the light, and basically saying go home. What's the difference between March when we did that and now?
Yeah, you know, I've heard a lot of this conversation as well is, you know, does the same level or does the same trend mean the same thing now that it did then? And, you know, it does in terms of we want to understand how much disease is spreading and how much the virus is spreading in the community. But we do know a lot more about what works than we did in March. Right? In March, we were still having discussions about was this primarily person-to-person contact or like surface transmission. Now we know a lot more. We know it's primarily person-to-person contact from one person breathing and the other person breathing the virus in. We've learned more about what works in terms of masking and social distancing being very, very effective. Whereas that wasn't really on the table on March. And so our tools are different now than they used to be, and our ability to understand patterns. The other thing, if you have to remember, who had tests in March, it was, you know, I remember talking to the state health department, they had a handful each day. And what we know about what's present around us is so much more robust and in depth than when we knew in March too.
Yeah, thank you. So I want to pivot a little bit. One of the other questions that we frequently hear is that, well, I understand 80% of undergraduate courses are remote. So why even bother? Why do a semester with some in-person instruction? And, you know, I'm going to toss this really to the entire panel. I don't know who wants to weigh in first.
Susan, do you want to take the first crack at that?
Sure. And that's a great question because it sounds like we're almost there. Why are we doing all of this complication? And there are really a lot of reasons, and I'm just going to mention a few, and then my colleagues can add in some others. One is all the things that we learned in the winter term in terms of what things are most important in terms of academic excellence and supporting our students. And for some of the kinds of courses and instruction that we do, if you can do them safely and you know, with a kind of public health informed way, you can really accomplish the goals of that instruction in a much more engaged, robust way. There's some of our students who really are much better able to engage in, focus on their academics, their studies, all of the different activities if they're able to be here on campus. And having some engagement, and of course it's different now given all of the risk mitigations and the other things that we're doing to be healthy and safety, it's still true that there is quite a bit more engagement than there would be if everybody was just home. And in fact, we know that a significant percentage of our students, the vast majority, were going to be in Ann Arbor anyway. And so having some engaged hybrid instruction just made so much more sense in that context. And again, we continue to learn the best ways to do that. So let me stop there, but those are some of the key things from my perspective.
Martino, did you have anything to add from a student life and a co-curricular perspective?
Yes, we believe that it's really important to give students the opportunity to engage with each other, with services on campus, in an in-person format, of course, in a much more limited way than they normally would. But as a new person to the campus community, just seeing students walking together across campus and having conversations with their masks on, of course, and seeing students show up in the DIAC to get their safety kits. Those are all socialization opportunities that wouldn't exist if students were at home in a basement somewhere. But it also allows our staff to really engage with students who need that more personalized engagement, and it's available to them. So there are definitely some benefits to even a more limited engagement.
Yeah, I'm very sensitive to the fact that we have students that this is the safest place for them to live. Either they're coming out of the foster system, or they don't have good local health care, they have food insecurity, they don't have internet connectivity. So, for some of our students, the ability to come to Ann Arbor, live in our residence halls, allows them to continue their education, even if only a fraction of it is literally in person. But I also know, Dr. Milana, you've got thoughts about the impact on psychological well-being of our students of having a fraction of in-person education, at least.
Yeah, just to quickly touch on that, Mark, it's this idea of loneliness that is so prevalent, and it's actually been part of the issues we've had on campus for a number of years, which is really kind of stunning to me as someone who went to Michigan a generation ago. It's sort of hard to believe people have those feelings. And right now, one of the big threats to health for our students, as well as our faculty and staff, is loneliness. And, I have some friends that are parents that they have twins, and one kid is home and one kid is here. And they say, "Are you kidding? This is better," even though it's not perfect. They're like, "That's what she knows." And she's very happy. And I just think about my own experience living on the 5th floor of Mojo, which, ironically is the site of an outbreak right now, or a cluster. But, I learned to really find my voice. I learned to really understand who I was being here. And I hope that our students, and when I talk about what is success going to look like, I hope that even imperfect, some of those things do move forward. So I might, I guess I'll transition us on to some other questions. And there was one question that came through, and I'm just going to read it. I'm teaching an in-person lab course, and I'm inundated with questions from students concerning possible exposures and how to react. For instance, a roommate has been exposed or is being tested. Is it safe for them to attend, or should they quarantine until the test results come in? I'm disappointed that there is not a resource to help answer these questions. So there's confusion on this. I don't know if Emily, if you want to touch on this, because you've been kind of at the center of the coordination, or if, one of the other panelists.
I know one resource. So there's going to be stuff specifically focused on the classroom. There's going to be resources coming out that are going to be available that the Campus Health Response Committee have designed to answer some of these frequently asked questions, point people towards resources. But there's also a hotline being stood up that is a great place to go, one phone number that can route you to people that can provide on-the-ground information, and can be a fast way to connect with those services that a student is probably looking for when they're asking those questions. And so hopefully by getting that distributed widely, we can give people an outlet to go to kind of one stop to get those questions answered.
And what's happening in our classrooms is, if a student tests positive and is in any in-person instruction, the registrar will send out a notice to all of the students in all of the in-person classes that the student who is tested positive is in, including the faculty member. Also, the student will undergo a case investigation and contact tracing. Just because you're in the same classroom as a student who tests positive does not mean that you need to quarantine, and does not mean that you need a test. It depends on the nature of your exposure. So for example, if you're lab partners and you're not 6 feet apart and you're in a room together for more than 15 minutes, then perhaps you're going to need to quarantine and be tested. However, if you're sitting in a large room with 10 people in a seminar discussion, and there's no further exposure than being in the same large room with good distance and everyone wearing a mask, then you don't need extraordinary measures. But just like we're letting people in the dormitories know that there's a positive case in the dorms, we're letting students and faculty know that there's a positive case in their classroom. And I'll just mention a kind of medical trick from, not a trick, but a medical practice from my earlier days as a physician. The way doctors and healthcare professionals protect themselves is they actually presume that everyone they encounter can potentially spread the illness. And you know that it's only very rare that you're going to run into somebody that actually has the illness. But if you approach your day realizing that anyone you don't know well and you're not in your bubble can potentially transmit the illness, and that reminds you to keep your mask on, keep your distance, stay out of large crowds, and you'll actually be fine. There's very, very little evidence at our university and elsewhere of spread of COVID-19 in the classroom. You know, most of the evidence of spread is coming from social circumstances or what's now called congregate living. That's my word of the year nomination, congregate living. We never heard that term until recently outside the public health profession. But dormitories, fraternities, places where large numbers of people live together. So in the typical classroom settings on campus, wearing masks and distance, the risk of transmission is extremely low. If the contact tracers think you've had an inordinate risk, they'll contact you and you'll be asked to quarantine.
That's great. Thank you. There have been a number of questions on testing. I'm going to actually read a couple and then we can talk about this. One is, why won't you give us free weekly testing like many other college campuses are doing? And can you talk about our levels of asymptomatic testing? And you know, Mark, I may turn that over to you since you've been very central to this discussion.
Well, I'll also rely on Emily in a bit because she's the brains behind the operation. But you know, if you think back to June and July, the United States as a whole was really suffering from inadequate capacity to do testing. And even across the summer months, as we were planning our curriculum, you recall stories of supply chain problems. You couldn't buy enough swabs or little plastic tubes or reagents to do the test. So that was a real problem. So as we were designing the semester, what we decided to do was set up a system where we would test all students living in our dorms before they arrive, and then target very specifically anyone who developed symptoms with a very low threshold to test, and then anyone who's been a close contact, we would test immediately. We were relying on Michigan Medicine, the health system, to provide that capacity, and they were trying to ramp up, but they're also responsible for clinics and for our inpatient 1,000-bed hospital. And we didn't want testing asymptomatic people to be a drain on testing people who presented to the emergency room with symptoms, for example. Since then, we've been growing our capacity, and I'll turn it over to Emily in a minute, but she's designed a surveillance system that helps us get an early sense of where disease is on the campus. And now with the advent of this saliva testing, we're ramping up even more. So we will be able to test much larger numbers of students and then faculty and staff who are working on campus who are asymptomatic to screen them and hopefully reassure the community. But I'll tell you, there's a lesson in the news today that we should pay attention to about testing. You can be tested every day and be in a fishbowl and you could still develop COVID-19. So testing doesn't prevent disease, it detects disease. It's masks, it's distancing, it's hand washing, these very simple century-old interventions that'll keep us all safe. But Emily, can I turn it over to you to talk more about the logic behind the distribution of testing and surveillance?
Yeah, absolutely. So I think, you know, so we've got the surveillance program, it's up, it's running, we're building capacity, we're inviting people as fast as we can to kind of ramp that up as much as possible. We're also looking at having outposts and having other locations to continue to make it more accessible to people. We're also switching to a system that's going to be much easier to come and get a test without having to do the phone registration and the appointment that I know has been a barrier for it just doesn't make it as efficient as it could be. So that's going to be great news for getting more tests done through the surveillance system. But I also want to bring up something that I'm really glad to see operationalized recently is all the tests that we've been bringing to the residence halls in response to situations and targeted testing as well. It's also asymptomatic testing, but it's asymptomatic testing kind of driven by something we've seen a signal and we wanted to dive deeper. And so we have now the capacity. I mean, we've you know, sometimes it's been a 3 to 4 hour turnaround time to get the signal that we decided to respond to and to get a team on the ground in the residence hall deploying tests. And so, you know, that's, I think, a really important way to think about asymptomatic testing is to bring the asymptomatic testing to the place that you want to investigate further and make sure that you're fully defining, you know, a potential outbreak you might be concerned about. So that's another development we've had lately that I think is great.
Thanks, Emily. And, you know, thank you for, this is supposed to be your sabbatical year. You know, I know this is like, she's been all in on this. And I'm going to just ask the last question. I think we're going to be at the end of the time, and it touches a little bit on some of the things we have talked about, but what are we learning about the on-campus exposure, trends, behaviors, policy adherence that can pass along to learn from each transmission? And, you know, one thing I'm just going to weigh in on this, and then I'll ask the group, is that masks work and that our students are wearing masks, at least when they're out and about. You know, they probably aren't in some social settings, and certainly within their households. And that the classroom setting and the, you know, libraries and other joint sort of communal settings have been incredibly safe in terms of transmission, and that the environment has not played a role. Like, that's something that has really come about in the last few months as our understanding is better. But I might turn it back to Emily for the final word on this. Like, what other things are we learning about on-campus exposures?
I'm learning gatherings. Gatherings drive, I mean, in this setting, that is my number one thing is gatherings are so important in determining whether transmission is gonna slow or if it's gonna speed up. You've got to make the size of your gatherings just smaller. I had this in my Twitter at one point, but my dining room has a huge wooden sign on it that says "gather" over it, over the dining room table. And a few weeks ago, I put a big sign next to it in my handwriting that says do not gather." I mean, gather, but gather safely, gather in small groups. That is, I think, the number one determinant of how things are going to go over the next couple of weeks.
Well,
I'm just going to. Oh,
Go
sorry.
ahead,
I was just going to. Yeah, sorry. Following up, I think that is the key, because college campuses are one big, large gathering. And I think, again, the word to the students is small groups. Try to keep your social pods similar. Be safe. Be outside. But do get together.
Yeah. So, yeah, I'd like to end this with one request. Please, everybody, particularly to our students, please cooperate when the contact tracers call you. You know, the more quickly we can talk to you about who you've been exposed to and who you may have exposed, the quicker we can control the disease and prevent people from getting ill. We're going to do this again next week. We promise next week we'll leave more time for questions. We'll go the full hour. Please do submit questions. We'd like to work our way through them, and the most common ones are the ones we'll address first. We'll have a different special guest next week and continue to update the campus throughout the pandemic. So thanks to Emily and to my colleagues in campus leadership. Be healthy, be safe, everybody. Have a great weekend, and go blue.